Hi there. My name is Sarah, and I have Megan here with me.
Hi.
And we're doing a presentation on meningitis. Our fellow students that also participated in this and provided the information are Lucia, Nova, and Lisa. Hope you enjoy.
So in pathophysiology, meningitis is an acute inflammation of the meningeal tissues that surround the brain and spinal cord. The inflammation can be caused by bacteria, viruses, and fungus. And meningitis is usually caused by a bacterial viral infection that starts in another part of the body, actually, typically the respiratory tract, and then invades the spinal and cranial nerves from there, as the picture shows. So in our etiology slide, we're looking at bacterial meningitis, and it is highly contagious and contracted via airborne transmission. So we have to apply airborne precautions, droplet precautions, and isolation precaution. It is considered a medical emergency, something you want to act fast with, and there is a high risk of mortality if it's left untreated. Babies and the immunocompromised are the highest at risk for contraction because they're low immune system. And the biggest culprits whenever it comes to bacterial meningitis are your group B strep and Streptococcus pneumoniae. And so when it comes to viral meningitis, big thing is to know it's the most common form of meningitis, but it's less severe. Airborne precautions will still apply. They still need to be on isolation precaution and to prevent the spread. And same thing, young children and the immunocompromised are the most susceptible to contraction. And it commonly occurs during flu season, so in the fall, winter, and early spring, when respiratory tract infections are the most common. And fungal meningitis is the most rare form of meningitis contraction because we're dealing with contaminated soil. And how that's introduced through inhalation, it's generally only the immunocompromised that are vulnerable to contracting that form of meningitis. So we won't spend any more focus on this. Okay, so when it comes to clinical manifestations, the big things that we're looking for is a sudden high fever, always indicative of infection. But then we will have with that severe headache, stiff neck, and vomiting and nausea. And other symptoms that can be included in that mixture would be decreased LOC, seizure, photo and phonophobia, signs of increased ICP, skin rash, and petechia. And the skin rash is usually around the trunk, but it can also be profuse and on the extremities as well. But the big three to look for is going to be your fever, your stiff neck, and your headache.
So the next slide is going to be over labs. For the labs, your primary diagnostic tool will be the cerebral spinal fluid analysis, so the CSF. The CSF is collected by lumbar puncture or spinal tap. Possible findings that we're looking for when checking the CSF include the clarity. Remember, clear is normal, so if the CSF is cloudy, it is indicative that there is presence of WBCs and other microorganisms. CSF proteins will be increased. CSF glucose, which is used in comparison with serum glucose, will be decreased. And CSF total cell counts will show increased WBCs. Next will be blood and bacterial cultures. Your CBC with differential shows a shift, any shift in serum electrolytes and helps determine dehydration. Serum glucose, which is used to compare with the CSF glucose. Bun and creatinine are used to determine kidney and liver function. This will help determine or adjust antibiotic dosing. CMP is also used to evaluate organ function. Gram stain of the CSF is used to determine if the bacteria is a gram-positive or gram-negative bacteria. And then the culture and sensitivity of the CSF will help provide information to determine the best possible antibiotic treatment. So with bacterial meningitis, antibiotics are the first-line treatment. The dosing of the antibiotics is based on age and weight and are generally used in combinations to help prevent bacterial resistance and to cover a broader spectrum of bacteria. Common antibiotics which are used for bacterial meningitis are the cefotaxime, ampicillin, vancomycin, and Bactrim. Bactrim is used for patients that have penicillin allergies. You'll also use analgesics to control pain, antiemetics to control nausea and vomiting, and antipyretics to manage a fever. With viral meningitis, there's really no specific treatment because antibiotics are not therapeutic in treating viral infections. So typically you would provide supportive therapy, which would include antipyretics as well, again to manage any fever, pain and anti-inflammatory medications, along with lots of rest and hydration. Nursing and collaborative treatments. With the assessment, you want to check the vitals and focus on the temperature. Temperature is extremely important. Assess the pain on a 0 to 10 scale and have the patient describe the type of pain. You want to monitor fluid intake, check for CMS of the extremities. With the CMS, you really want to determine if the patient has lost sensation in their extremities. Next, you'll want to check the respiration patterns and the effort it takes to breathe, as well as neurochecks to monitor for signs of increased ICP. On the comfort measures, priority is to control the pain, fever, and nausea. You want to provide a dim and quiet environment for those with photo and phonophobia. It is also very important to keep the patient warm to prevent shivering because shivering increases ICP. On collaborative care, a nutrition consult will be needed as well as respiratory therapy. PT and OT will help with range of motion exercises and ambulation as soon as it is possible. And lastly, a surgical consult in severe cases where amputation is needed. We have several nursing diagnoses here. First is going to be the ineffective tissue perfusion related to cerebral edema and hypovolemia with evidence of diminished pulses, extremity pain, and altered motor function. There's also going to be acute pain related to increased ICP, as evidenced by patient reporting a pounding headache of a 10 out of 10 on the pain scale. Also hyperthermia related to infection, as evidenced by elevated body temperature greater than 100.3 degrees Fahrenheit. Activity intolerance related to infection as well, as evidenced by fatigue and lethargy. There's also the interrupted family process, which is related to the critical nature of the situation and uncertain prognosis, which is as evidenced by unknown duration of hospitalization. Sometimes these infections can cause a patient to be in the hospital for months at a time. Anxiety also is one related to crisis situation and threat of death, as evidenced by expressed fears of unknown outcomes.
Okay, now we're looking at potential complications. And with any potential complication, it's all about early identification. And with these specifics, we're looking at risk for brain damage related to cerebral edema. So the big thing is treating the fever, and that includes not allowing the shivering. So keeping them warm and comfortable enough and treating the fever with our antipyretics. Risk for seizures related to cerebral edema. Again, that's tied to treating the fever. Risk for dehydration related to hyperthermia, and vomiting. So we're going to check our skin turgor, the mucous membranes, and also replace fluids. And we have this formula of 800 mils per day plus 100 mils a day for each degree of temperature above 104 degrees Fahrenheit. 100.4 degrees Fahrenheit. Thank you, Sarah.
No problem.
Risk for septic shock related to bacterial spread. So we're going to have to check those vitals, and the vitals are going to be our big key in identifying signs of shock. Okay, so with considering discharge planning, depending upon the severity of the infection for the patient, they may have been in the hospital for months, and they're still going to need a lot of discharge planning potentially. This includes their nutrition and their exercise. They may need PT. Amputations do occur with these types of infections. And then they need lots of rest. The fatigue does linger, especially with viral meningitis. And other than that, making sure that they have all the resources to be able to follow up with those appointments. So the next slide you'll see is a video about a young man that contracted meningitis, and it kind of shows how detrimental it can be, if not to the extreme of taking life, but it can affect your life permanently, just from this infection that comes on hard and quick.
This is one of those stories that is almost too hard to believe. The unimaginable force of a virus and the unimaginable force of the boy who fought it. 13-year-old Tyler Preston.
He initially presented obviously quite sick. He had low blood pressure, when unable to keep his blood pressure up, and ill. He had a large rash on as well.
Within minutes, he was quarantined at CHEO. Something was very wrong. It is meningococcal meningitis, and it was eating him alive.
And when I walk into the room, everybody's gowned masked, and Tyler's surrounded by doctors and nurses, and they're taking blood pressures, they're doing everything. And I'm what's going on? Oh, this is terrible, this is getting worse and progressively worse.
And it got much worse.
His heart was beating very fast, and his eyes were closed, and I thought, don't you dare go on me. Don't. You're not allowed to go.
Because of the disease, the small blood vessels get clotted off and blood can't get to the tissues, and that tissue dies, and unfortunately his lower legs had to be removed because of dead tissue.
And then it became a battle to get ahead of the spreading virus.
They're vacuum bandages, and what it is sponges with kind of like saran wrap wrapped around them. And what it does, it's attached to tubing, and the machine sucks out all the bad stuff.
The bad stuff is diseased tissue, and if it's not destroyed, it will attack healthy tissue.
In his case, Tyler lost essentially all the skin on his lower legs, so it used to be about no skin at all, sort of down to the muscle, and we've over time taken more and more skin from his belly and put it on his legs.
When it did stop spreading, he needed to pick up the pieces, missing 2 legs and having a badly damaged hand. He doesn't complain. He even goes to school at CHEO.
Tyler has, from the very beginning, he couldn't wait to get in here, take part in a normal activity. There were times when I could tell that, he wasn't feeling great, but he was like, no, I'm going to be here for my hour. And he's a great example even to the rest of the class.
After so much suffering, so many painful skin grafts, getting his body to bend and move is excruciating, but necessary.
I'd say right now the one that I think is the worst is probably my arm, because my fingers don't work as good, but I mean my legs, I'm bending them and I'm moving them, but I can barely move my arm, so.
As far down as you can go. Pull it down harder, bring it down. He's really, he's coming along, and I think his personality is going to definitely be his strength that's going to take him through all of this.
What has helped Tyler get through this horrific fight is the Army Cadet Program. He's proud to be a cadet. His captain visits twice a week.
Tyler's only been a cadet for a month and a bit, and he already understands the importance of the family aspect of the cadet program and the military program in general, and that the CO of the unit typically is a member of your family.
We have one more promotion to do tonight. I'd like to call forward Sapper Preston.
And when he returns to that family, a warm welcome.
Welcome back, buddy.
Thank you.
And a special invited guest, Jody Middick, a Canadian soldier who lost both of his legs when he stepped on a mine in Afghanistan.
The biggest thing was I tried to tell him was not to close his mind to anything, because that's when you start to slow down, as you think of things you can't do, or you worry about what you can't do, instead of concentrating on the things you can do.
I'm extremely proud of him. He is absolutely my hero. He is an absolute brave young lad, and I'm so proud to have him as my son.
And from another hero, a Canadian hero, a special gift, the compass he was carrying in Afghanistan when he lost his own legs. They both survived against the odds. Heroes who fought for their lives and won.
All right, everyone. Well, thank you so much for taking the time to watch our slideshow, and I hope you enjoyed the video and kind of had some realization of how severe meningitis can actually be. Here are our references, and we hope you have a great rest of your semester. Thank you.
Do-do-do.